Hey YouTube, it's Alex. So I'm watching a documentary called Breast Milk on Netflix, and I just started it. And if some of you watched me a long time, you know I'm very pro breastfeeding. If you're a new subscriber, which thank you, I'm very into breastfeeding, and I'm not going to get in the stories, but Dante was breastfed, but it was difficult, but he was breastfed for 18 months, and I did it, woo! And then Kara got my breast milk for, just my milk, for 3 months in the NICU, and then I wasn't with her enough the last month of her being in the NICU, and she got way too used to the bottle, and she wouldn't even try to breastfeed. She would push away my breast by the time I really got to be with her at home, and it just wasn't successful, and it always broke my heart. Even till this day, it broke my heart. But I'm determined to have this baby, which is 36 weeks. This is not the 36-week update. This is all about breast milk. I want to do my 36-week update later in the day with Paul. So you'll get 2 videos today. But anyways, what I was saying, I'm really worried because I'm having a tubal the day after my vaginal birth. Hopefully I get to my vaginal birth. But after my vaginal birth, they want you to have your tubal the next day after. And I'm really worried about that. I'm worried about it ruining the breastfeeding process. I really don't want the baby to bottle feed at all. I'm really worried. The surgery, I don't know how, to expect from it. They want to do a spinal block, which I'm totally, not wanting. I want to be conked out all the way. And I heard that, general anesthesia will, kind of make it difficult for breastfeeding. They didn't really explain that, so my next appointment I'm going to ask way more questions about that. I meant to do it last appointment, and I totally spaced it, so I'm going to set a reminder on my phone to remember to talk to the doctor about instead of getting a spinal block. I've had 2 spinal blocks, one having C-section with Kira, and then the second one, spinal block, was for my cerclage, and I remember having severe back pain for a whole week and just hating it. You would think my cervix area would hurt from the cerclage, but really it was my back that caused me the most discomfort and pain. So I'm hoping to go under general anesthesia for that. But I heard that it's better to have a spinal block if you're going to breastfeed. And I don't quite know. Maybe you guys know, but I need to know those answers. But I'm worried in general because it's yeah. Oh, great. She's telling me she pooped. She's been doing so good potty training. And this last few days, she has not been going in the toilet. I don't know. She goes back and forth. But that's not what we're talking about. But she's telling me she pooped. Hi. Ooh, she did poop. So I'm going to try to wrap this up. Why didn't you go in the toilet? Why not? So yeah, I'm worried about wanting to bottle feed her while I'm in surgery. I don't know if I get to go right back to my room right after surgery, or if they're gonna make me go in what is it called after you have surgery? The post-op, where they have watched you closely. I can't remember what it's called. I have no idea. I've never had a tubal before. And I'm worried about the surgery in general taking too much time away from my new baby. You know, I don't want to be separated at all from the baby, but I need to have this surgery done because of my, having terrible pregnancies, and I don't want any more children anyway. So I'm really worried. I'm getting more worried about the breastfeeding. My goal is to have a better breastfeeding experience than I did with Dante, and I already know I will, just because Dante is my first child and I was learning on my own and discovering how this works, how that works. And since I am a a veteran of breastfeeding, not with this little one, but breastfeeding for 18 months. I think I can say that I have breastfeeding experience. So I already know that will be easier, but it all depends on the baby. That's another big reason why I want to carry this pregnancy so much longer, because the closer they're born to the due date, the easier they are to breastfeed, for them to latch and to be more interested in the breast and more alert about the breast, more eager, more curious, more, and you know, like that's like their thing. They said since Dante was born at 36 weeks and 2 days, which is crazy because I'm 36 today, they said that he was still a late preemie, and that's why he had kind of trouble latching and being interested in the breast, because he was more on the sleepy side because he was early. So now that I'm getting closer to my, you know, giving birth, whenever that day is, I know it's close, but I don't know what day it is, I'm getting more anxious about the whole breastfeeding process, and the surgery is gonna happen, so I have no idea how much that's gonna... I know you pooped. I'm about to finish the video, and then I'll change your butt. Change it. I didn't get a potty train her decently like I did Dante because of this terrible pregnancy. Took the baby bump. Where's the baby?
Down.
And kiss the baby? Cute. She always has to lift my shirt up. Like, I can't be like, where's the baby? Shh. And then she'll lift the shirt on her own and do it. And she has a ritual when she kisses everyone and goodnight and everything. She has to say goodnight to the baby, hugging the baby and kissing the baby with mommy's shirt up. That's funny. Watch. Let's see if she do it. Where's the baby? Where's the baby? Can you kiss the baby? Can you kiss the baby? She's like, no, I just want to watch myself on your phone, Mom. Oh, she's not doing it. Usually she'll lift my shirt. But anyways, I don't know. How do you guys feel? Did any of you passionately want to breastfeed, and you guys had a tubal? How did it affect the baby? Because I don't want to bottle feed. I know that Paul has to be with the baby the whole time. Like, that's my thing, is like, don't leave the baby with anyone. Stay with the baby the entire time I'm gone during my surgery. And I have no idea how long the surgery is. I didn't even ask that. I don't think it's long. Yeah, I should write these questions down and ask the doctor more about the surgery process. But I'm really worried about the general anesthesia or the spinal block, if there's a difference of it messing with my milk supply. I don't know if I need pain medication afterward. And if she really wants to tell you guys she pooped. Sorry. Poop, poop, poop. Poop and breast milk. Yay. Yeah, I'm just worried about the surgery just really interfering with my milk supply. Really worried about that because I am so passionate about breastfeeding. Formula, my personal feelings on formula, I am against it. I don't want to go through it. I had to go through it with her, and I hated it. I hated formula, and that's my own preference. So, I just don't want the surgery to ruin something so beautiful, which is breastfeeding. And it's not only about the breast milk, it's about breastfeeding the breast and the baby. So, I'm going to get off this now because I'm babbling, and I need to change this little girl. And I'm hoping after I have the baby, I can focus more on her potty training. Say bye-bye.
Bye.